We are going to see the algorithm of how to interpret a chest X-ray. We have A, B, C, D, E, F. A of airway, B of bones and soft tissue, C of cardiac silhouette, D of diaphragm, E of effusion, and F of fracture. The airway should be in the center of the chest X-ray, aligned with the vertebral bodies here, and like this the trachea. It would be a little more vertical, the right mainstem bronchus, than the left, but not too much. I think that I exaggerate, but anyway. This should look like this. The B stands for bones. We have the clavicle, ribs. It looks like this. This will be posterior, and this will be anterior rib. Then we will have the sternum in a lateral view. This will be the head, this will be the body. We will have the vertebral bodies, and in a lateral view, here we would see it. Here would be the spinous processes. Here we have the vertebral bodies and the spinous processes superimposed. Next, the cardiac silhouette. In the cardiac silhouette, we have here the heart, more or less like this. Alright, so first we have the aortic boson, which would be here. Here will be the aortic boson. Next we have the pulmonary artery in the left, and between we have the aorticopulmonary window. Next we have the auricle, and next the ventricle. I think that I did this prominence very markedly. And here will be the descending aorta. Next, in the right, we have in mirror image the right pulmonary artery, the auricle, right atrium. The right atrium would be a little bit below the level of the left one, and maybe we could see here the ascending aorta, how it is ascending like this. We would see the ascending aorta. So in the left is aorta, aorticopulmonary window, pulmonary artery, right, left atrium, left ventricle, descending aorta. Right, ascending aorta, pulmonary artery, and right atrium. We will see it like this. Next, the diaphragm should be like this, and we could see a gastric bubble. We should measure the distance because sometimes we could see increased distance, and this could indicate some, or could suggest some pathology that we will see more on. After the gastric bubble, we have the effusion that we will see later, and the fracture we also will see them later. So now the diaphragm and the gastric bubble. I forgot here the diaphragm and the gastric bubble.